Welcome to the Shared Decision Making and Your Healthcare Tools and Tips for People Living with Chronic Pain webinar. We're glad you're here today. My name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability. This webinar is co-sponsored by ourselves, CIRPD, and Pain BC, in collaboration with the Canadian Pain Coalition. It is also made possible through the support of the Direct Access Program through the BC government. As I mentioned, my name is Tanya, and I'll be moderating the webinar and handling the Q&A session today, and our presenter is Dr. Janet Jull. Janet Jull is trained as an occupational therapist and has worked in clinical positions throughout Canada. She has also worked in a range of health policy and management positions. She has a degree in occupational therapy from the University of Western Ontario and a master's degree from Dalhousie University, in which she focused on informed consent. I want to welcome Janet today, and thank you very much for being here, and I'll hand it over to you.
Great, thanks, Tanya. That was a great introduction, and it's great to be here and great to be able to share the information that I have today. So we'll just go to my first slide here. Hopefully everyone's seeing everything okay. Just let Tanya know if there's any issues. So in today's session, we're going to learn about exploring decisions about care with your care providers and learn ways in which you can speak and articulate your values and preferences during the process of making care decisions with your care providers. You will learn to articulate your care decision-making needs to care providers, and you will learn ways to plan the next steps in the decision-making process with your care providers. So just to start, what is shared decision making? I've been mentioning the term in this presentation, and it's, and we're here to talk about shared decision making. And to start with, I'll define by what I mean with this term. This is an area which has been developing in healthcare in the past 30 years, and today there are many researchers and care providers who are working in the area of shared decision making. Shared decision making is a process during which care providers and their clients collaborate to make health decisions, considering both the best available evidence and client preferences. It's particularly appropriate for preference-sensitive decisions in which there are several options available and evidence does not point to one clear best choice, such as can often happen in the area of chronic pain. It's also appropriate when clients must make difficult decisions about trade-offs between pros and cons of treatment. So shared decision-making has a lot of research supporting it as a good thing in the lives of healthcare clients and in the lives of care providers. It's a process of making decisions that leads to higher quality treatment decisions. It's supported by strong systematic reviews. It has no serious unwanted side effects. It's popular with healthcare clients and families, and it's crucial for patient or client and family-centered care. But studies show that it's provided to less than half of eligible clients. In shared decision-making, clients are encouraged to take an active role in their health care by communicating their preferences to care providers and sharing information that influences their decisions. Care providers support their clients through this process by communicating evidence and its uncertainty in understandable terms, helping clients to clarify and articulate their preferences, and providing opportunities for clients to ask questions, state concerns, and share information. So in this diagram here, it's just showing that there's the more traditional paternalistic model where the healthcare provider makes all of the decisions, and then the far side of the other side of this model where there's informed choice, and the client decides alone, so just takes all of the information and goes off and does not consult with the care provider. And shared decision making is the middle ground where there's a real collaborative process happening. So in shared decision-making, there are two experts or more if there's a healthcare team working with the client. All are experts in particular areas, and while this slide states that the client and their family are experts in what matters most to them, sometimes they can also be experts on particular healthcare issues. And we see this in pediatrics quite often with children who are diagnosed with rare diseases or disorders for which there's not a lot known in the healthcare world. So these families are really valuable sources of information. The families and the child become very well informed about the clinical features of the health issue. And in the area of chronic pain, there are also areas in which the client may bring a great deal of clinical information, having seen many specialists and learned a lot from care providers during their time seeking care. But just besides all of this, clients and families are experts in what matters most to them. And the clinical expert brings a lot of expertise in the area of best evidence, research evidence, and skills from their particular healthcare area. So the main outcome in shared decision-making is that there's a two-way flow of information and that the care provider partners with the client to make a decision and agree on a treatment plan together. So when is shared decision-making appropriate? It can be appropriate for difficult decisions. Factors that make decisions difficult include one more than medically reasonable treatment option, or uncertainty about the best treatment option because evidence just isn't clear on what the best treatment option is, and the decision is preference sensitive. There are a range of options. So preference-sensitive decisions, I've been bringing that term up quite a bit, and I'm just going to define that for you here. The preference-sensitive feature of decisions is important, and really this refers to a decision in which there's no clear right choice, and this can happen in many different situations. So there can be more than one reasonable option, or a lack of evidence, or experts can disagree on what the best, what the best evidence is. The best choice ultimately depends on how the client weighs the benefits and the harms of all of the different options. So some examples that might come up in the area of chronic pain could include, should I have an MRI for lower back pain, or should I have surgery for jaw pain? And those are just a couple of examples of many, many different preference-sensitive decisions. So the preferred role in decision-making may vary between different people. Some would like to have a great deal of support in the decision process and have the care provider participate and maybe even make a decision for them. And that's just fine as long as it's the client, leading that. But studies have shown that greater than 90% of healthcare clients want to be involved in the decision in some way. And they want to hear about what the options for treatment are and to have their opinions considered. Despite this, less than 50% of clients are offered treatment options. And this lack of client involvement in their care decisions can lead to a range of issues. So it can lead to unwarranted practice variation where particular healthcare providers tend to provide one particular treatment all of the time, when in reality there may be a range of different treatment options available. Not achieving evidence-based practice, because the reality is it's very, very important to use best evidence to inform practice. There can be reduced treatment adherence, meaning that the healthcare provider may prescribe a course of action, but the client may choose not to follow up on the course of action because it doesn't work for them. It's not what they feel is in their best interests, but this doesn't come out in the clinical encounter because there's no discussion. And then there's decisional conflict, which I'm going to go ahead and define for you right now. So decisional conflict, it's uncertainty about which course of action to take. And one negative outcome for healthcare clients that may result from not being involved in the decision-making process is called decisional conflict. Decisional conflict occurs when the choice among competing actions involves risk, loss, regret, or a challenge to personal life values. It indicates an individual's level of comfort with a decision and can be expressed, for example, by feelings such as anxiety, or physically, such as being unable to sleep, or in thought processes, such as a preoccupation about the decision. Now, decisional conflict, the outcomes of decisional conflict are not good. Studies have shown that people who experience decisional conflict are more likely to delay their decision, to change their mind, to feel regret about their choice, or to blame others for bad outcomes. So in the area of chronic pain, there may sometimes be no one right solution. What works for one person may not work for other people. Everyone will take a different path, and it may take trial and error before a person finds a combination of approaches that works best to deal with their specific issue. The key is to take an active role in pain management. And this means being an active participant in care, which means participating in making decisions with your care providers in ways that you define are best for you. The shared decision-making approach, which employs best evidence, can support a relationship with your care providers so that you collaborate and manage your care in the best way possible. Your participation in care is a critical part of an evidence-based approach. Evidence-based healthcare, or medicine, is the standard for practice throughout the realm of healthcare, all of the healthcare professions, and it's critical for developing good clinical expertise. It consists of the overlapping areas of the clinical state and circumstances, the research evidence, and the client preferences and actions. The practice of evidence-based medicine requires the clinician to use their clinical expertise to integrate the three components of clinical state and circumstances, research evidence, and the client's preferences and actions. But many care providers lack the skills and expertise required to identify or elicit patient preferences, the client preferences, and their intended actions. Study has shown that even if clinicians are experienced and have a positive relationships with their clients, their inferences about client preferences are often wrong, and this can adversely affect their relationship with their client. People can feel vulnerable and reluctant to express their concerns to their care providers in these situations because they fear being labeled as a difficult patient and receiving care that's not as good as a result. This is why it's important that people play the role of an activated healthcare client. So the activation of clients within the healthcare system are being taken up, and this is a quote taken from the National Health System, or the NHS, in the UK. They have implemented shared decision-making within their health systems, and the no decision about me without me is their catchphrase and a way of engaging users of the healthcare system in a process of shared decision-making. So it sounds great, but how is it done, and how can you make it work for you in managing your care? So this diagram depicts strategies to support evidence-based shared decision-making. In clinical settings, the use of patient decision aids and decision coaching are used to support shared decision-making. Decision coaching is a strategy in which care providers are trained to work with their clients in a way that fosters shared decision-making. So when healthcare professionals participate in decision coaching education, they've been found to be more likely to use patient decision aids and to share decision-making with clients. There are evidence and theory-based educational programs developed and evaluated by the Ottawa Hospital Research Institute research program on their website, and this information is something that anyone can access and use. So you can just Google decision aids and it will come up as the first hit. So decision aids are evidence-based tools used to facilitate shared decision-making when there is more than one reasonable option or clinical uncertainty exists. They can be used to enhance the client and care provider communication by standardizing information on the pros and cons of the medically reasonable options. Decision aids also help with clarification of client values and preferences about important trade-offs between the different options. Decision aids allow for communication of values and preferences to care providers, so decision aids structure a conversation between care providers and their clients. And decision aids also ensure that the selected option is consistent with client preferences. So these are really useful things. They're very useful tools. And there's a lot of evidence supporting the use of decision aids and as supporting shared decision-making. The evidence for shared decision-making is so strong that it is being implemented internationally in the US, Australia, and the UK, and in areas of Canada as well. There's a Cochrane review of randomized control trials. Randomized control trials are considered the highest standard for research trials. And these trials show that there is very strong evidence for the use of decision aids to support people making treatment and screening decisions. So this one randomized control trial, the latest update which I have here, indicates that studies are showing that the use of decision aids improves knowledge of options for clients, helps people to have more accurate expectations of possible benefits and harms of each of the options. supports people to reach choices that are more consistent with their informed values, so their preferences and their choices align really nicely. And it also supports greater participation in decision-making with healthcare providers. So I'm going to show you some examples here. Whoops, my thing is not switching here. There we go. There we go. So I'm going to show you some examples of decision aids for conditions associated with chronic pain. This is one health-wise decision aid for heel pain, freely available from the A to Z inventory of decision aids at the Ottawa Hospital Research Institute. So if you just Google decision aids, the Ottawa Hospital Research Institute decision aid site pops up, and there's an A to Z list there, and you can find different decision aids there, and also information on shared decision making. This is another example of a decision aid for making decisions about treatment of low back pain. These decision aids can be done online or printed and done on paper, and while they can be used by people at home alone, they're actually designed to be used with the care provider and meant to enhance or facilitate the visit with the care provider. So if you were to want to try out one of these, what you could do is you could go through this decision aid and print it off and then take it in with you to your healthcare provider and review it with them and share it with them, because that's the conversation, the process is the really key part of using decision aids. They're a facilitator. They don't replace consultation with healthcare providers. This is an example of a decision aid developed for a back care program at a U.S. institution. And they have a website there covering a range of decisions which might need to be made for management of back care issues. And again, decision aids are informed with best evidence and structured to guide the user through a process of making a decision for care that works best for them and in collaboration with their care provider. And all of these decision aids are available online. So this is another example, and this one is of a generic decision aid, and it's called the Ottawa Personal Decision Guide. This can be used with any health or social decision, and it's an example of a decision aid designed to help prepare people for a visit with their care provider or to be used with their care providers as a guide during a decision-making process. And I've included the website for this at the bottom, but again, it can be found if you Google decision aids, and this is at the Ottawa Hospital Research Institute website. We're going to review the steps of the Ottawa Personal Decision Guide, which takes a structured approach through the steps of decision-making. So the first step involves identifying the decision that needs to be made, and this part involves exploring and clarifying the decision, a critical first part of making a decision. The next step involves developing knowledge of the options, and there can be many. And the OPDG, the Ottawa Personal Decision Guide, lists space for 3, although there could be more. And of course, you can always add more, or write on the back or whatever it is you need to do. The next part is that you list you develop your list of pros and cons for each option in collaboration with your care provider. And then you, as the client, need to score how much each option's pro and con matters to you. And there's a star system. So if it matters a lot, there's 5 stars. And if it doesn't matter that much to you, it could be 1 star, 2 stars, whatever. This ensures that your values for each option are clear. When we use this in the hospital, we'll usually give the pen to the client to fill out the form to ensure that they're putting down what matters most to them. And this stage involves the articulation of the client values and preferences in the care decision. Then the client indicates their preferred option, the support they have in their lives, and the role that they prefer to play in the decision. And keep in mind, during this process, there's a conversation going on between the care provider and the client. This section of the OPDG, step 3, is the one in which people identify their decision-making needs to their care providers. And this series of questions identifies the decision needs. Study has shown that people who answered no to one or more of these questions are more likely to delay their decision, change their mind, feel regret about their choice, or blame others for bad outcomes. So it is really important to work through these steps, and if you do answer no to any of these, you can identify potential decisional conflict, and you can revisit the areas in which you're needing extra support. And each of these steps here, the knowledge, value, support, and certainty, they all are mapped out on the OPDG. So the final and last step involves planning next steps. So where do you go? Where do you go now that you've got a sense of what your decision is, or if you need something more? This list is not complete, and it can be added to. And the main point is that if you've not made a decision, you leave with a plan to obtain more information to help you with making a good decision. So the Ottawa Personal Decision Guide provides a nice outline for clients and care providers engaging in the shared decision-making process. So in conclusion, the treatment of chronic pain may involve preference-sensitive decisions and many preference-sensitive decisions in a person's life. And being an activated client supports you to participate in your care decisions in the way that you want to participate. And I think that often we can feel quite intimidated going in to see our care provider and feel that, you know, it's not okay to speak up. But really, it is really, really important to be an active, engaged participant in your care, and to expect that your care provider will respond and provide you with the opportunity to participate in making your decisions about your care. Some people may require decision support to make an informed, values-based decision with their care provider. And today we've talked about preference-sensitive decisions, and I do know that this does come up quite often in the area of chronic pain. There is no one particular right answer to every issue that people are needing to make decisions about. So so sometimes decision support is could be very helpful. Decision aids can make the decision explicit and provide balanced information about the pros and cons of each option, clarify values of what matters most, and plan next steps in care. And I think most importantly, decision aids really structure a process between the care provider and the client and engages them both in a conversation about the best care plan. And for that reason, I thoroughly believe in them and strongly recommend their use when there are preference-sensitive decisions to be made and people that do want to participate in shared decision-making with their care providers. Okay, so that concludes my slides here. And I don't know if anyone has any questions, or or Tanya, if you have any comments. But I'll stop talking now and let respond to any questions that may come up. Thank you.
Great, thank you very much, Janet. At this point, we don't have any questions yet. So if people online want to go ahead and type up any questions you have. I did have a question. Would you find that these decision aids are helpful no matter which type of care professional, like whether it's a therapist or an MD doctor, like your general practitioner, or if it's like occupational therapist, physical therapist? Like, does it matter which kind of health professional you use them with?
It does not matter. And sorry, Tanya, should I be typing this in, or is it okay just to speak back?
Just speaking is fine.
Just speaking is fine. Okay, thanks. No, any healthcare professional, and really, you can use shared decision making about social, for social decisions. I mean, sometimes, I'm always pulling the guide out for my children, for example, or if a friend is struggling with a decision, should we get a dog or not? Again, just going through this deliberative process can really can be very, very helpful for people. And then they know they've covered everything off and can have a lot more confidence in the decision that they arrive at. In the healthcare system, so I work as a research associate at the Children's Hospital of Eastern Ontario right now, and they're implementing shared decision making throughout the hospital, and as part of our research project. And we're training MDs, the specialists of quite a wide range of specialists. We're also training therapists, social workers, really anyone who has client contact and is interested in supporting shared decision making in their clinical area can benefit from this. And sometimes we develop specific tools and approaches for their particular clinical area, and other times we just recommend more of a generic approach to having the conversation with the client. So so it's a very versatile, adaptable approach to making decisions and about your health care.
Very good. We do have one question. Someone asking if there's a decision aid for fibromyalgia treatment.
You know, there actually, I believe there is. If you just Google patient decision aids, and I don't mean to be pitching the Ottawa Hospital Research Institute too much, but it is actually internationally recognized as sort of they have all the decision aids that have been developed there and evaluated. There's a standard for evaluation of decision aids for their quality. So if you go to their website, you can actually scroll through, like look through the decision aids there. You can see what kind of quality evaluation the decision aid has, and then often you can download them for free and take a look at them. And it might be something that could help you if you wanted to print it off and take it with you to your healthcare provider and, show it to them and ask them, what they think and see if you can engage in a process of shared decision making with them. There are other sites. If you just Google patient decision aids, you will come up with other sites, and there's some in the U.S. and as I mentioned, in the UK, and Australia is interested in shared decision making too, and for their population. So, but yes, there is one for fibromyalgia that I've seen on the A to Z website.
Oh, sorry, I had muted myself.
That's okay.
Someone asked, are healthcare providers becoming open to this type of interaction between a client and a provider?
They are. Now, I'm not, as a healthcare provider myself, I will say that we often think we know best, because we see clients, day in, day out, and, you meet someone new and you think, oh, yeah, I know what's best for them. Like, you've got, these ideas in your head because this is what you do all day, every day. But I will say that we have had many care providers come to us after learning about shared decision making and say, I never thought about it this way before. And when I reflect on how I'm interacting with my clients, because we have them role play and try out different approaches to interacting with clients using shared decision-making approaches. I have had healthcare providers say, I didn't realize that I was imposing my views on them. I honestly thought that I was, open to everything, that I was including them in the decision. So I think sorry, this is not directly answering your question, but what I'm trying to say is people are coming around to this, healthcare providers, because we're also healthcare clients at some point too, and when you have the experience of not having your views listened to, it's eye-opening, and as a healthcare provider. Also, we're also legislated to engage in a process of informed consent with our clients. Shared decision-making is a really great way to ensure that your client understands what it is they're agreeing to. So it's really important. In the U.S., shared decision-making has actually been legislated in Washington State, I think, for elective surgeries, because it's a litigious society, so it's really important to be able to prove that your client has knowingly agreed to a particular intervention. So the province of Saskatchewan has taken up shared decision-making and is promoting that in some of their healthcare delivery services. And as I mentioned, in the UK, it's being rolled out throughout the UK healthcare system. As very important. And then in Australia, there's similar actions. They have the Ask 3 questions, encouraging people to go to their healthcare providers and ask 3 questions. What are my options? What are the risks and benefits of my options? And what are the chances of these risks and benefits happening? So in Australia, they're trying to activate people to ask questions and engage with their care providers, and hoping to change the health system a little bit in that way as well. So yes, it's happening. It's slow, but as clients and users of the healthcare system, if you can, not challenge your healthcare provider, but yes, you don't want to have a conflict with them, but it is really, really important that you let them know that you want to be an active decision maker in your care, and that you really need to know what the options are and what the risks and benefits of those options are. That would be very helpful, and I think good for your care provider if they're not already doing that.
Very good. And then someone asked, are you able to go through an example or demonstration of the process?
Yeah. Well, you know what? We just, I actually used the Ottawa, I'm just going back to the slides here, the Ottawa Personal Decision Guide. So this, I put the slide back up here. Everyone can see the slide, yes? Is that right, Tanya?
Yes.
Yes, okay. So I pulled that up, again, not meaning to pitch Ottawa's work or, the work done at Ottawa Health Research Institute. This guide has been taken up all over the world, like in many, many different healthcare settings. And it's because it's a generic guide, it can be used anywhere. But it also takes you through 4 key steps. So if you just read at the top here, the Ottawa Personal Decision Guide for people facing tough health and social decisions, and you'll be guided through 4 steps. So the 4 key steps are clarify your decision, explore your decision, identify your decision-making needs, and then plan the next steps. Those are the key steps. So, I mean, really, you could take, you could take any sort of decision. We often have people try this out, like, what decision do you face? Oh, should I get a dog? So do I get a dog or don't I get a dog? So your decision is, do I get a dog? What's your main reason for making this decision? It's time, the family wants a dog. When do you need to make a choice in the next 2 weeks? How far along are you with making the choice? And you could say, thinking about the options, tick that off. And then you go down and you work out reasons to choose. And so option 1 is get a dog. Option 2, don't get a dog. And then you just fill out the boxes. And you could do that with anything. If you're thinking about an intervention, I use the MRI for low back pain. Should you get an MRI? So that could be your decision. Do I get an MRI for low back pain? My physician's recommending it, but I'm not sure. What's my reason for making this decision? Well, my physician's recommended it, and I'm having a lot of pain. When do you need to make the choice? He said, I need to decide in the next couple of weeks. How far along am I with making this choice? I'm thinking about the options. So then you just go through option 1, get an MRI. Option 2, don't get the MRI, and so on. So it's very stepwise and can take you through the whole decision-making process. We use this quite often to train healthcare providers just in the process. So they may or may not use this guide, but it teaches them the steps that they need to go through with their clients. So when they have a conversation, they mentally check off these 4 different areas, and just to make sure that they've covered everything they need to cover when they need to make that difficult decision about surgery or whatever whatever it is they need to decide with the client. I'll stop talking there.
All right. And then there was another person asking, could you talk a little bit more about decision support? I'm not sure at which point you mentioned that, but they were wondering where do we get this support, or what exactly were you meaning by decision support?
So decision support, so there's evidence-based shared decision-making strategies. So there's patient decision aids, but there's decision coaching, and that's a really key part. And I actually believe that, while decision aids are wonderful things, to structure a conversation, it's the relationship you have with the care provider is really key, and the decision coaching is something that healthcare providers can be trained to provide. Some of them are probably doing it already and not realizing that they're doing it. But again, it's supporting people to go through the 4 steps here in the OPDG. So this generic decision aid is a summary of the 4 steps again. And so the decision coach is trained to take people through those 4 steps and support them in making the decision that the client defines as best. And sorry, is there more to that question, or Tanya, do you want to run it by me again and make sure I've answered it correctly?
I think that was it. I think they just hadn't really realized what the decision support topic was and what that meant.
Okay.
And is it something that I mean, I would say from personal experience that also
Yeah,
you can get decision coaching from a therapist or a
anybody.
psychologist as well, or a
Anybody.
spouse,
Yes, well,
partner.
if you, again, if you want to go to the Ottawa Hospital Research Institute website, just Google patient decision aids. They have a section there on what is decision coaching, and it can clarify it. There's like an online tutorial that you can do to learn about shared decision making and a bit about shared decision or about decision coaching and the role of that in shared decision making. And again, we train MDs, therapists, social workers, child life, like anybody who is supporting clients. We train them all in decision coaching. And it's really understanding what shared decision making is and the basic steps of shared decision making. And it's also role playing. So we give them opportunities to role play, how they would have these conversations with their clients and how they would engage clients in voicing their preferences and integrating their views into the conversation, to make the decision.
Everyone for being here, and thank you, Janet, for your presentation.
Thanks, Tanya. Thanks,
Ha
everybody, for listening.
and I hope you all have a great rest of your day.